Dr. Joseph Kanu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truths for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. To be a part of the show, call 313-838-1035. That's 313-838-1035. And now your host, Dr. Joe.
Well, good evening, everyone. This is Dr. Joseph Kanu broadcasting live from Rochester Chiropractic Clinic. And we have our wonderful guest, Dr. Jeffrey Haddad of Rochester Advanced Dentistry. Welcome to the show, Jeff.
Great to be here. Thank you.
Yeah, and thank you for donating your time. And I know how busy you are at the office, and you have a wonderful family, and that you dedicate this time.
I appreciate that. No, I'm enjoying myself. We have fun every week, don't we?
Yes, it is. And I cannot believe, I've got to tell you, how much of an education it's been for me. Because I thought I knew a lot about, teeth and dentistry, and I knew there was more to it than just cosmetics.
Yep.
But I have learned even about cavities, and we've covered so many wonderful things.
Yeah.
And I've known you for a while now, but it's still wonderful to know that I'm still learning too. And I think by blessing others, by watering others, you water yourself. And I'm really enjoying how much I'm learning.
Well, I mean, ditto. I'll tell you, I not only learning what, your field has to offer, and you and I have kind of learned together with a lot of our pain patients, but some of the stuff that I know. I mean, I know my area of expertise, but when you really start to prepare for some of these topics, you learn even more, and you really start to realize that there's a lot out there that we all need to learn. And I mean, I'm a big nerd. You know that I love going to school, and I'm continuing my education at all times, and this is part of it. You really have a lot of information out there. It's great.
It is. It's wonderful. So now, if anyone has any calls pertaining to dental issues, mouth issues, we have not just a dentist here tonight, but the mouth doctor, Dr. Jeffrey Haddad. You can call the station at 313-838-1035. And for any calls, we'll open that up.
Sounds great.
Okay, so, Jeff, can we kind of recap a little bit last show?
Yes.
We were talking about, periodontal disease.
Correct.
Plaque, and so build-up, basically, too, right?
Yeah. Well, that's where it starts, and we covered a lot. And really, I think the biggest, hot topic with periodontal disease these days is the connection between it and other conditions in the body, for whatever reason. And, I have this conversation daily with my patients. People don't realize that even though there are bacteria in their mouth, it doesn't just stay there, okay? We're all connected. And, the same plaques and bacteria that builds up in your mouth also builds up in the rest of your body and can settle in areas, especially in the heart. Heart disease and periodontal disease, gum disease, is directly related to each other. I have patients who are sent to me.
Can you repeat that? So,
periodontal disease increases your chances of heart disease. That is a fact.
Yes.
It's an accepted fact. It's been proven, and more information and technology that we have to test that keeps coming out every day, to a point where the medical profession, which is a great thing, has actually bridge the gap with the dental field, which is a nice change. Yes. And I have cardiologists that I work with, family physicians, that patients are sent directly to me to make sure that we get their gum disease under control because of their susceptibility to heart conditions and heart attacks. So it's we're learning. Everybody's learning, and we're learning a lot more. And so last week we talked about the risks that periodontal disease has on the rest of your body. And at the very end of it, this is very interesting, we mentioned sleep apnea, which also has a huge effect on your heart, your blood pressure, your brain, the rest of your body. What did we talk about it? 2 minutes, maybe, out of the whole half hour. My office was flooded with phone calls the next day asking about these sleep apnea appliances. And so people want to educate themselves.
So we know that is an issue.
It's a huge issue, and that's what the issue we want to talk to. It's a very hot topic.
Yeah.
And it's sleep medicine is a very, very young area of medicine. In fact, the father of sleep medicine is actually still alive. So
I thought you were going to say he's asleep.
No,
right now.
he may. I hope he is. It's a little late, but you see how young this area, this science is, and we're just learning so much about it. So when we have this cause and effect of sleep apnea, which is actually stopping breathing at night, and
terrible.
the effect of it has on your brain and your heart and your blood pressure and obesity.
All the tissue of the body, right?
Everything.
You're not getting oxygen to all the tissue. Hey, Dr. Haddad, can we go to a couple of callers?
Sure, that'd be great.
I don't mean to interrupt you, but we're going to go to Brett first. Brett, how are you? You're live and on the air.
Hi, Brett.
Hey, my question was, I get like canker sores like randomly. Like I can't drink orange juice because of the citric acid. I drink a little bit of orange juice and I'll get like 2 or 3 of them, and then I don't drink juice. I just drink straight water, and I'll still get canker sores like crazy. Like what can I do to like prevent those in general?
Brett, sometimes there's a lot of people that are more susceptible to canker sores than others. Stress is a big factor. I don't know if you're going through stressful times or not, maybe not getting as much sleep. When your overall immune system is down, canker sores can flourish. And so, and to be honest, I went through that myself when I was in college. And again, stressful time, bad sleeping habits, all that stuff, bad diet. And unfortunately, some people like you, it sounds like, are more susceptible. What I'd recommend is really what you're doing. Stay away from the acidic foods as much as possible. There are some great, and in fact, maybe even Dr. Joe has some good home remedies, for them. I'll tell you, a really neat thing, back to technology, that we actually do for our patients is we use a laser on canker sores, and it's not what you're thinking. It's not us doing any type of cauterizing or burning. It's on such a low level that it's literally just the light that goes right on the canker sores. I've treated myself. I've treated my family, many patients. It's an amazing form of treatment. Now, if you got a really, and I know you've had them before, really, really painful big ones, that you don't even know if you're going to be able to get through the week. Again, those are the types of things that your dentist may be to offer you if he or she has a laser, which we do at our office. So that was what I recommend. It sounds like you're doing the right things. Yes. I wish there was some better ways to avoid it, but again, taking care of yourself, getting good sleep, and keeping your immune system up is
alkaline. Hey, Brett, can I interject?
Please.
Something here? Have you tried L-lysine for the canker sores?
Say that again?
L-lysine. Have you ever heard of an amino acid called L-lysine?
No,
Usually it's when you're getting too much arginine in your diet, or the acid, like Dr. Haddad said, stress-induced, poor diet, but acid, it's an acid environment, or too much arginine, that are found in nuts, like around Christmas, you're eating a lot of pistachios and nuts, and that can cause a bit. We have a supplement called L-lysine, and you can take that internally. That helps. But also you can make a little paste with it and put it right on the canker sore. It works like a charm.
Perfect.
Or the laser, like you said. It's nice to start with the laser.
Oh, yeah.
Okay, to kill it. Now, the other thing is the healthy chocolate the raw chocolate really turns your body alkaline. Okay? We have that at our office, both the L-lysine and the chocolate.
I actually started eating that myself, and I have to say it's pretty amazing.
So, you can call our office, 248-656-1011, or contact Dr. Haddad.
Yep, at 248-656-2020. You can go on our website as well. It's RochesterAdvancedDentistry.com. There's some information about how we use the laser for canker sores as well.
Super.
Yep.
Thanks for the call,
That's a great call.
I hope that helps. Okay. Hey, we have George on the line, too. Hi, George. You're live and on the air.
Hi. Yes, I have a question. I was wondering if you have some kind of a home remedy or something I can buy in the store for a mouthwash.
Okay.
Well, what are your goals with mouthwash? Is it just bad breath? Is it health of your teeth? There's a lot of different ones out there. So,
you know what? I really don't have a problem with anything right now. Like, I don't think my breath stinks or anything. But I just want to know something that I can use to gargle or whatever.
Well, you know what I'd recommend, and it's just pretty new actually. It's a Crest product, and it's an all-in-one. So you've got your Listerines out there that really is an antiseptic. It's you're breaking down bacteria, and again for fresh breath. But what it doesn't have is some fluoride, and there's some other ones out there like Act that's a true fluoride rinse. Well, just recently.
Okay.
Crest came out with one that has both, and I believe Listerine was also talking about that. So what my recommendation, get one that has both. It's going to kill two birds with one stone, and it's going to protect your teeth, and it's going to keep the bacteria down in your mouth.
Okay.
That's a good one.
All right? So really you're
All
looking for added fluoride in
that's
there.
a good one. You know what I've told my patients? I mean, just for a home remedy, if you didn't want to use that for some people who are purists, who don't. And you know what? I like the fluoride rinses. I know we're going to get into that
Yes, we are.
eventually because it's nice to do that. But, George, you can take cinnamon, a teaspoon of cinnamon, a teaspoon of the cloves. I'm sure you use clove in your office, right? It's bactericidal, virucidal, and it has an antiseptic property, and it kills parasites. And I rinse with lemon, the juice of a whole lemon, cinnamon, and clove powder. You can rinse your teeth, leave it on your teeth for a while, and for about 10-15 minutes. It kills a lot of bacteria and viruses, but it doesn't get in as good as your laser does into the sulcuses.
Yeah.
But that's not a bad thing, George. And then you could brush your teeth and then do this fluoride Crest rinse. Man, that would be a good combination.
That's
as a preventive.
I'm just lazy, George, so I just buy my mouthwash. I'm always getting showed up by Dr. Joe here.
Yes, but you know what? The cinnamon and the clove and the lemon, you can rinse your mouth and then swallow that because it's actually good for your whole body.
Do not swallow the fluoride rinse.
Right.
I highly recommend against that.
Yeah.
Hey, thank you, George. Appreciate the phone call.
Yes. All right. So, Doc, let's try to get back to what we were talking. We were recapping the periodontal. We're going to move into the sleep apnea.
Well, yeah, it's sleep apnea, snoring in general. I really like to educate people on snoring because what people don't realize is that all snoring is pathologic. Okay, this isn't just some
all snore. So it's not something that's funny.
No, well, and of course it is. People make jokes about it, and oh yeah, I snore, no big deal. But what they don't realize is that is a sleep breathing disorder. You have partial blockage, and that's what causes the vibration there. And so, unfortunately, if you start off snoring, the odds of you having sleep apnea, or more importantly, becoming a sleep apnea patient, are extremely high. And it's because you've got that partial closing of your airway. And when you get older, unfortunately, we all put on weight, even if we're trying not to. Our necks get thicker, and that partial blockage can become a full blockage. And if it gets cut off enough, you will stop breathing. That's what the definition of sleep apnea is. You're actually stopping breathing. Sometimes 10, 20 seconds to a minute at a time. Think about stopping breathing 10 to 15 times a night.
Yeah.
30 times a night.
Not good.
What could that do to your body, your brain, your heart, blood pressure? I mean, it's a scary thing. And so what the biggest thing every patient that comes at our office we have a medical questionnaire, and on it is, have you ever been told that you snore? Do you snore? Do you have fatigue during the day? Because people are going through life in a fog. People who snore, people that say
such a shame.
They don't realize
you don't have vitality.
Yeah, they just don't realize it, And I have personal experiences with my family members, my own dental partner, Dr. Doolin. We should bring him back and have him tell his story, because I'm going to tell you, the first 2 days he wore this appliance that we make, which, by the way, everyone's thinking on lines right now, it's, I can't wear an appliance. First of all, it's so comfortable that you wouldn't even know that you're sleeping with it. I've worn one just to test it out. I like to do that. After 2 days.
How big is it, Doc?
It says,
How much does it weigh? I mean, it's 2-3 pounds?
Oh, good Lord, no. No, if you jump in a lake, you're not going to go to the bottom by any means. No, this is acrylic. I mean, this is very, very, custom fit. It's like a night guard.
How big is it compared to a football mouth guard?
It is a little less bulky. It is harder, though. It's a hard acrylic, but similar size.
So it really fits, custom fit.
It's important, very important. In fact, unfortunately, there's a lot of things out there, marketing, internet stuff.
Acrylic, you almost don't know you can't see it then. It's transparent.
Well, actually, the appliance that we make is kind of a reddish pink material. That's just kind of the way it is. And actually, the reason they do this is because when they're clear, sometimes they get lost a lot easier.
I see.
Okay, so
because you're wearing it at night anyway.
Correct. That's correct. Yeah, we're not walking out. This is only at night you're sleeping with. And what I was going to say was, over the counter snoring appliances, internet appliances. I mean, believe me, they promise you the world. Unfortunately, you get what you pay for. Yes. I mean, you can get one for $50 or $60. I promise you. Listen to my words. Don't waste your money on the $50 or $60, because I have several patients who tried it and they wish they didn't because they're uncomfortable. They didn't help. And unfortunately, some of these patients were actually put into a headache and pain spiral.
I'd be afraid of it changing your bite.
It's a huge side effect
how
of
much
appliances.
The change in your bite can cause headaches, neck problems, wear your jaw joint, the TMJ joint out, right?
Correct.
The cartilage.
Correct.
And I'd be very concerned to mess around with that.
Well, you should be. And here's a cool stat.
I mean, it's tricky enough with somebody like you who's making a specific, precise, custom-made one.
And we have to be careful even with that. And so, to have the knowledge of the jaw and all that is very important, because sleep apnea patients and TMD patients, TMJ suffering patients, are a lot of times the same person. 52%, half of all sleep apnea patients have TMJ problems, and 75% of TMJ people have sleep apnea.
Okay, so
overlap.
So if you have jaw pain,
there is a very good chance that you have sleep apnea as well.
Which you call TMD.
TMD is a temporomandible joint disorder. Correct. Yeah, good clarification. I'm sorry. That it really is it goes hand in hand. And so I'm glad we're bringing that up. I mean, if you've suffered with, if you've ever been told you have TMJ problems, if you do snore, really do yourself a favor. Consult with your physician. Consult with your dentist. You have to be trained as a dentist to utilize the technology out there, be trained as a sleep, dental professional. But there are a lot of them out there. And if not, please find one. Obviously we're here to help if you need us. We've been doing this for a very long time. I take it very seriously. It's a very big focus in our practice. And along with the
snoring is basically too.
Snoring.
I mean, which is the lead into.
You got it. This appliance.
Apnea.
You're correct. This appliance is made for snorers and sleep apnea patients, because again, they're usually the same person.
Well, how many patients would you say, if you snore, what percentage has apnea, sleep apnea?
Well, I can tell you that 67% of Americans snore, okay, and 25% of them snore habitually. Okay, that's a lot. I mean, 1 in 4 of that group snore habitually. The apnea, that's a difficult stat to pick, because you could have, say, a very low index, meaning maybe you stop breathing once or twice a night, okay? And that's very mild sleep apnea. And like I said, there's other people who stop breathing 50 times a night, all right? And you can go through phases of this. If you are a very mild sleep apnea patient, if you are a little overweight at the time, okay, and you are, not doing the healthy things that we talk about on our show each week, eating right, nutrition and all that, you're going to stop breathing more, because you've got the extra weight. You're not getting down to that good sleep, and your jaw's dropping back and blocking that airway.
Blocking the airway.
Okay. I've had my own physician, okay, very, very large practice right here in Rochester. he was wearing a CPAP, which we should talk about. The CPAP is the standard of care in sleep medicine. It's a big machine that actually forces air down the airway, keeping the airway open. It's the standard of care. It works 100% of the time. Unfortunately, it's only used 29% of the time. It is a very, very low compliance.
Huge. That's a terrible compliance.
It's unfortunate.
Terrible
because
compliance.
Any patient...
Well, it's so noisy. Now, that is a big, cumbersome...
Very bulky. And who wants to be trapped to a machine?
Right. I mean, and plus the sound of the thing.
I've had patients say they felt like they're on life support.
Right.
Claustrophobia. They get very... Who's like Darth Vader there?
Yes, I mean, you're hearing this.
Yeah, it is. And so...
Terrible.
It's a great thing, but unfortunately, the majority of patients either won't wear it or can't wear it. And so at that point,
plus it's really not putting the structure in the proper position, right?
No, it's
so you're just like blowing through the problem.
You are, but the reason it is the standard of care is that it's proven. I mean, it's effective in all patients. However, back to my story of my own physician. He was a CPAP wearer forever.
CPAP, okay. So he was the 29%.
Correct.
Who was compliant.
Correct. Yeah, as compliant as he could be. But it got to a point where he said, you know what, I'm ready to make a change. And so he went on a diet, started exercising, lost a significant amount of weight. I made him an appliance. And now that is what he does.
Wow.
Instead of the CPAP.
Well, how much improvement has he had?
He says he feels exactly the same as he did before. And then, just so you know that this is fluctuating, he did put the weight back on. And then he didn't feel comfortable with the added weight and the appliance. So he went back on the CPAP, and then was determined to get back down to his fighting weight, if you will.
Yeah.
And he did. And so I just want people to understand that this is this needs to be managed. This disease needs to be managed. And again, if you're snoring, there's a very good chance that you have already had some sleep apnea problems. So what I would recommend, and again,
so it's multifaceted. There's more than one answer to fix this.
No question about it. But the way that we do it in our office is we actually send people home with a monitor. We have a monitor that we send people home with free of charge. That will
that's tremendous.
I just want the information.
Okay.
My patients, deserve to know.
How many dentists do you know send their patients home with a monitor like this?
I don't know. I think
there's
few. I think we're few and far between.
So that's fantastic.
Yeah, well, after we have that information.
So what does this monitor look like? Is it a whole big headset?
Not
they
at
stick
all.
their head in
no, it is
in a space suit.
Believe me, this is
big round like George Jetson or something. No,
similar. No, no. It's as simple as having a little cannula going up your nostrils.
Two little things.
Yep, having a little monitor on your finger.
That's measuring oxygen.
That's
like
correct.
The little thing you put because we have that at our office.
Correct.
Measuring oxygen.
Correct. And then just a little, I would say, 5-inch by 5-inch square that straps on your chest that, again, just records everything with a little USB port in it. And it gives us a printout that's a screener. Is it as accurate as a sleep study? Absolutely not.
But it gives you a ballpark. How many times you're stopping breathing a night, right?
Without a doubt.
And also your blood oxygen level, right?
You'll like
Which is so important.
Yeah, you like the word hypopnea? Hypopnea is a little different than apnea. Hypopnea is just when your blood level oxygen goes below an acceptable level. And again, that's not as bad as an apnea, but still not as good as not having them. So it even measures that. And so after we get this report, I can tell you if you have mild, moderate, or severe. If you have moderate or severe, I'm going to recommend that you see a physician, and we work very closely in the area with some physicians because if you're willing to wear a CPAP, then do it. If you're not, or if you can, I'm here for you. I'm here to help you. If you are able to, the appliance we make it's a life changer.
Well, plus before you need the CPAP, right?
Right.
Like what we talk about, before you completely blow a disc and need disc surgery, see a chiropractor before it gets so bad. Or we were talking about amalgam fillings or cavities. You want to catch it early onset, so that it's not this major problem. Now you need the root canal, and it's $2,000 and blah, blah, blah,
Yeah, so if you're a snorer, please don't be in denial.
So if you're a snorer, you need to do something about it.
In my opinion,
there's a step,
absolutely.
And this is a step. Because
get yourself screened and find out. Find out if you have a problem. Find out if, and not only that, but we never even concentrated at all about the fact that maybe your significant other really needs you to stop that snoring.
Yeah.
Intimacy, marriages are being destroyed by snorers. They literally are making houses now with extra rooms because people are requesting them because husbands and wives are sleeping in different rooms because of snoring.
Because of the snoring, and it's a serious problem. I get the complaint a lot, mainly from wives saying, I can't sleep next. I'm not getting any sleep. Why? My husband is snoring.
Yep, you got it.
So if you are snoring, what we talk about too is, the brain and the spinal cord is electric. We run on electricity, but the best vitamin we have is not on my shelf. It's taking an extra breath once in a while.
Got it.
Getting oxygen. We need oxygen is what fuels the space shuttle.
Yeah.
Oxygen is so volatile. We run on oxygen. That's heavy fuel. You don't want your oxygen dropping. If you're snoring, that means you're gasping already. You're compromised. That's a serious problem. You want to take snoring very serious.
At least educate yourselves. And again, if you want more information on this, please. My website has all kinds of things on there, RochesterAdvancedDentistry.com, or call our office, 248-656-2020. We truly change people's lives every day with these appliances. Yeah. And at the very least, you can find out if you have a problem. If you choose to do something about it, that's on you. Yeah. You're not going to hurt my feelings if you don't do anything, but I'm a big believer that education, information is power. Do yourself the favor and find out if you have a problem, and then if you want to take care of it, then you can do that.
Yeah. So basically, and you're saying almost 70% of Americans snore.
That's correct.
So if any of you listeners out there have a snoring problem, I really strongly would encourage you to call Dr. Haddad's office. Take that monitor home. What is it? Is it 1 night, 3 nights?
1 night.
1 night is all you need.
One night. We'll sit down together.
Home.
We'll discuss the results, and we'll discuss a plan
for you.
That's
a wonderful thing. I'd like to do that. I don't snore, but I would like to try that monitor
do that.
just to see what happens.
Yeah, that's good. You can give feedback next week.
Hey, Doc, next week I'd like to continue on this topic of sleep apnea and get into the appliances a little deeper.
Good, we can do that.
Okay. Thank you so much for coming.
Thank you for having me.
And you can contact us, too, on our website, simpletruthsforhealthyliving.com, and there's a link for Dr. Haddad. Please, if any of you have a snoring issue or know someone who does, contact his office and take the monitor. Take him up on that generous offer to take that and see if you have a problem that can be helped before it becomes too dramatic. And remember, in all that we eat or drink or do all things to the glory of God. And Doc, can you come back next week?
I'll be here next Wednesday.
Great. Thank you.
Looking forward to it.
God bless everyone. Have a good night's sleep.
You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.
The content on this program is for sharing general information purposes only. It is subject to change with ongoing research. It is not meant to diagnose, treat, prevent, or cure anything. Dr. Kanu encourages you to make your own healthcare decisions based upon your own research and in partnership with a qualified healthcare professional of your choice.